Hi, welcome, Zhanna. Thank you so much for coming and speaking at the Words of Wisdom series. It's so good to have you here.
Hi, Shamini. Thank you so much for having me. It's a real pleasure to be here with you today.
Okay, I'm going to go ahead and introduce you to the audience a little bit and read from your bio. And then we're going to hear some of your stories. And get into some questions after that. So, Zhanna was born in Belarus and immigrated to the United States at 11 years of age. She has been stuttering her entire life. She grew up on the West Coast and attended University of California, Los Angeles for college. After college, she pursued medicine at the University of California, Irvine School of Medicine and traded coast for residency in emergency medicine at Johns Hopkins Hospital in Baltimore. She subsequently moved to New York to pursue a fellowship in medical toxicology at NYU, New York City Poison Control Center. Zhanna currently lives in San Francisco with her family and works for the University of California, San Francisco as a clinical professor in emergency medicine and a program director for the Medical Toxicology Fellowship. Living with stuttering has been a lifelong journey for Zhanna, and she is grateful to be here to connect with her stuttering community. So wonderful. I am going to toss it over to you to share some of your story so that everyone can get to know you a little bit. And then we will have some questions together. So the
Okay,
floor is yours.
great. Thank you so much again for this opportunity. I so as you mentioned, Shamini, I grew up in Belarus and stuttered since I don't remember a time when I didn't. Let's just say my mom says it was maybe from the time I was 2 years old, and from probably when I was first able to speak. And we immigrated to the US when I was 11, with to Los Angeles. And I will, my stuttering certainly continued to be a part of my life and still continues to be a big part of my life. I I stuttered. I was very severe when I was a child. I don't think I could say a fluent sentence until I was probably in my 20s. And I had these hopes as a child that when we immigrated to the US, that somehow my stuttering would go away. I distinctly remember that I was hoping that I wouldn't have it in English, and I sure did. And so I was very lucky over my life. I really enjoyed and excelled at learning and education. And so I took a lot of pride in getting good grades and doing well in school, which is what got me to medical school and through college, and on the path before college also. Um, but my speech and my stuttering never left me. And I would say I was such a severe stutterer in junior high school and high school that I distinctly remember giving a presentation in my junior high school history class and having the teacher stop it and asked if I needed an ambulance. He asked me if I was having a seizure. Distinctly remember having that memory, and I was just mortified because my stuttering was very physical, and I would have a lot of blocks, and I had a lot of movements of my body, my eyes, my arms, my head. Not everybody stutters the same way, but this is how I did for a very long time. And over the years, I've had lots of different treatments. lots and lots and lots. So I grew up at a time, obviously, I grew up in a what used to be the Soviet Union before the fall of the Soviet Union. And so my upbringing was a little bit different than I think somebody who would have been raised in the US. But my mom, I think, was desperate for me to speak fluently. And I remember being a child going to some village to a woman who spit around me and prayed. It was like a lot of really interesting treatment modalities. I went to traditional speech therapy. I did energy healing. I I think I even had speech therapy once where I had marbles inside my mouth, like really old school speech therapy that was in Belarus. I and after a while, I think I just kind of became withdrawn and I just thought that this is what it is. I didn't have many friends as a child. I maybe had one really good friend and she accepted me for who I was. So it was kind of just me and her against the world. And that was in elementary school. And then as I moved through my education and got a little bit more confident because I really enjoyed education. My speech didn't improve, but I got more confident because I saw myself progress through various educational stages and getting into college and then getting into medical school. But in medical school is when things really hit the fan. I remember being interviewed for medical school and I could not say a fluent sentence together to my interviewer. I distinctly remember being asked a really reasonable question. I can't tell you what that question is because I can't remember what it is now, but I remember just starting and blocking and starting and blocking. And I went to my car after my interview and I cried because I was so frustrated with myself. I had so much inside of me that I wanted to say, but it just would not come out, as I know is, a very common experience for a lot of us. And somehow I got into that medical school. I don't off the wait list. I don't know how, but I did. It was UC Irvine. And in medical school, I thought of doing research. I thought of doing careers where I didn't have to speak. Just, I mean, in research, you have to speak. That's not fair to say you don't have to speak, but you could certainly hide yourself a little bit more, be less visible. I thought of doing computer science. I thought of being a sign language interpreter because I thought this is perfect. I don't have to speak. I could just sign. And like, I really thought it was a really viable career choice for me. And, I probably would have done really well as a sign language interpreter, but I was a very stubborn human. I always have been. And I think it's worked well in my survival toolbox over the years. Um, oh, I apologize. And I said, okay, well, I'm going to try medical school because I'm not sure if I can do it, but it was so hard to get into one that I'm just going to try it. And, I clearly liked science and I liked humans. It wasn't like, oh boy, I really didn't want to be a doctor. I just was stubborn enough about trying to be one. And so the pressures of being in medical school and especially during clinical months. So our school was structured in a way that the first 2 years were just mostly in the classroom. And then in year 3 and 4, you had to do clinical years where you were just like in the hospital, seeing patients, talking to different teams and to your bosses about your kind of your thoughts about patients for a grade. I mean, I was being graded. So there was my whole self-esteem right there. Like if I got a bad grade, as the only thing that was keeping me afloat was my grades at that point. And I found myself really struggling in that environment of my third year of medical school, where I could not keep up the facade that everything was okay anymore. And I found myself quite depressed, and I obviously has been really hard living with stuttering all my life, to that point, with lots of, different points where I suffered a lot as a child, and a young adult, but I thought, like, at least I had my education, but at that point, everything just seemed hopeless in my life. And I thought, well, I can't do this. And I just didn't really have it. I didn't have I guess, the knowledge at the time that I could just pivot and do something else. My mind was so set on medicine at that point. And I distinctly remember just being depressed, very depressed. I didn't shower for weeks. I still went to classes, but I didn't shower. And I slept a lot, had all the symptoms, and I was very, very lucky. I had a mentor who was assigned to me in medical school, Dr. McGuire, Gerald McGuire. I think he saved my life because I went to him and I said, "Okay, it's been great, but I'm ready to quit. Like, I am done. I cannot speak anymore. I cannot be a doctor if I can't speak." And he himself is a person who stutters, and you may have heard of him. He's taken on quite the leadership role in a stuttering community and has done some amazing research on stuttering. And if you haven't, I would encourage you to look him and his work up. Um, and he sat with me and he looked at me, and he's a psychiatrist by training. So I got really lucky there too. And I remember that moment he told me that I was depressed and that I needed to be on medication, and that he assigned me a psychologist of his choosing. And he said that if I don't go, he's going to hospitalize me, basically. And I did not want to be hospitalized because I just finished a psychiatry rotation where I felt very welcomed because of Dr. McGuire. I felt like I wasn't really alone. And I really admired him and looked up to him so much. And I said, there is no way I'm going to end up on that psychiatric unit where I just finished rotating. And I was so scared of that alone that I did everything he told me to do. I went to therapy with Dr. Gina Riley, who ended up being my therapist for 25 years until she retired. And I didn't like it. I hated it. I hated it. I didn't like it. I didn't like what she had to say. I didn't like going to therapy. I thought it was all for naught. I thought, why do I need this in my life? I'm fine. I took the medication because I was afraid, not because I liked it at the time. And and this is when I started to kind of pull on some resources and try to think, what can I do to change? And what do I need to get better, to a better place? And of course, therapy, I think, opened up those avenues a lot for me, just digging deeper, trying to understand what was it that was making me so depressed about my speech. And I just wanted to say, well, isn't it obvious? I stutter. That's depressing. But it was just that work that we did as a team that made all the difference in understanding that maybe it wasn't the stuttering itself that was making me depressed, but everything that I've put on it over the years as a wastebasket for everything else in my life that I've used that didn't go well. And it was really easy, right? It was really easy to use it as a waste basket. Poor me. I can't believe this is happening to me. It's because I don't speak like everybody does. It's because I sound a certain way. It's because I look a certain way, right? It's so easy to use that as a crutch, or as maybe a wastebasket is the wrong term, but as like a placeholder for something else, because it's just tangible and it's there already, and there's angst associated with it. And so Dr. Riley was also a speech language pathologist, and a psychologist, and she had a PhD, and she was incredible in every way. And I but I wanted, so she did speech therapy with me, and she did therapy with me, which was great, but I wanted results now. I wanted results now because I just could not see myself on antidepressants. I could not see myself going to therapy long term. As you could tell, I'm a very impatient human being too. And so stubborn and impatience, probably not the best combination, but so be it. And so I sought out at that time intensive speech therapy courses. I forgot to mention that during my first year, that summer in between the first and second year of med school, Dr. McGuire took me to the National Stuttering Association meeting. And it was my first meeting. I've never been around anybody except for him who stuttered in my entire life, just never met anybody. And it was eye-opening. And I actually met somebody who has remained a friend and a mentor to me during that time when we would talk. And he was a prolific figure who's really accomplished so much in his life. And I looked up to him also in terms of being a person who stutters, who has been successful in his life, however he defined it, and was very well known, gave a lot of speeches and television interviews, was just quite a speaker. And I thought, okay, I want to do that. I want to be that. I want to be like him. And so during that time, he said, well, maybe you should do intensive speech therapy, and maybe that will get you over the hump of feeling like you really need to get through this faster in some way on the other side. And so, which is when I looked around the country, and at that time, there were only a few places doing intensive speech therapy. And even though my therapist warned me over and over again that therapy is a long process, it doesn't happen overnight, and speech therapy is that too, that I may see some immediate results, and it's an ebb and flow, 2 steps forward, 1 step back, etc. I just wanted to see a tangible result for my, I think, psychological well-being. And so I found American Institute for Stuttering at that time. Oh my gosh, I can't tell you the exact year that was anymore. That's bad. So what, Chamonix, like 2003? I don't know. I can't remember. Probably 2003, right?
Probably maybe 3 or 4. What
Yeah,
year were you between in med school? Do you remember that?
third and fourth year. And so I was, oh gosh, maybe 2004 then. Maybe
Hmm.
2000.
A long time ago.
Long time
Long time ago
ago.
now.
Yes.
Yeah.
And
Yes. Yes. And it was different then. There was different everything. Yeah. But continue. Yeah. This is
got it. And I can't even assume it's the same place anymore that it used to be, but it was, I met Chamonix there, and she was one of my um, therapists during my intensive speech therapy program. And of course, as you all know, is amazing in every way and such a gifted therapist. And became a friend after that, which I'm so happy about. And program was it like, it was a month, maybe? A month? Maybe a
Three
little bit
weeks.
over a month. 3 weeks. Okay. Thanks,
3 weeks.
Shamini.
I think I ran it like on Wednesdays, and and Catherine ran it the rest of the time, maybe. It's hard
Think
to remember
so.
back, but
It
something
was
like
just
that.
you and
Yeah.
her, yeah, at that time.
Yeah.
And so I remember learning a lot of terms and a lot of ideas that I've never heard of before, and learning that stuttering is an iceberg. I still have my notebook from that
Oh my
program. I
gosh.
kept it all these years. I can't say the last time I looked
Wow.
at it, but I have it, and I've moved around the country quite a bit, and I've held
Wow.
on to it. Yeah, I have my notes and everything, but I don't ask me the last time I looked at it. Um,
It's a
and
relic.
it was it was
It's a relic now.
eye-opening. It was eye-opening, and you were able to give me tools that made me feel like I was had some control over my speech during certain times, because that's really what I was looking for at that time, in addition to thinking about advertising and thinking about acceptance, all the things that are equally as important and were new concepts to me, because I really did not have a good relationship with my stuttering at all, growing up and being a young adult, and being an adult. And so I came back reinvigorated from my AIS time, and I did something really drastic because I felt like I needed to. I went to rural India to work in a little hospital in the middle of nowhere in the Himalayas, because I felt like I needed a reset. I needed a mental reset from everything that was happening in my life. And so being in med school allowed to do that. And so I felt like I was still getting class credits, etc. And that trip was amazing. I'm not recommending this for anybody to do, but it just so happens to be a trip that I took myself off of all my antidepressants. And I was only on one, so it wasn't that bad. But I'm not recommend. I'm just sharing my experience. By no means is this a model that I want anybody to follow. And I felt alive and I felt refreshed. And that experience just made me come into my own a little bit more, I felt like. And so when I came back home, I was ready to continue my work with Dr. Riley. And I've had some tools in my belt, even though in my toolbox that I could use, but by no means did they last. By no means were they perfect. By no means were they these solution that I needed for myself, but it was enough to get me through a really tough time in my life. And so, and with a lot of work and a lot of therapy, I've was able to get to a better place over the years and change my relationship to my stuttering, and with that came more fluency for me. I would probably be okay if I wasn't more fluent too, and there are times that I'm not. But that ebbs and flows for me as well. And so the rest you guys kind of already know. I was able to heal and go on to do more training. I trained in emergency medicine, probably a field that somebody who stutters would just cringe thinking about it. Cringe. I mean, I used to cringe thinking about going into it, just talking on the phone all the time, yelling in like loud rooms. uh, but I did a rotation in it and I loved it. And they thought, okay, like this is the new me. Let's try it. Let's try to grow. And it wasn't easy, but it was worth it for me. And then I did a fellowship and I stayed and lived in New York for a decade and then changed coasts recently. And yeah, and that's kind of the story. I'm sorry it was more than 5 minutes, Shamini, but that's I guess a brief overview of my stuttering life and life.
It's more than fine that it's over 5 minutes. It's whatever it takes. And I'm almost like want to rewind and be like, well, wait a second, we don't know all about that last part there. I feel like that's so integral, but wow, you shared so much that I know nothing about.
Really?
And yes,
Oh,
it was really amazing to hear all the pieces and how incredible how you were connected to a lot of the right people at the right time in your life.
lame.
I didn't know Gerald Maguire played such a pivotal role, or it sounded vaguely familiar, but wow, he really,
They
yeah,
saved
you
my
told me
life.
part of that
Yeah,
before, but yeah. And
yeah.
your willingness to, um, I guess the stubbornness has been helpful. Instead of just bowing out, you took him up on it and you went for that and you persisted. I just see like persistence beyond almost comprehension in your story. Like you just relentlessly persisted and continued forward with so many obstacles, walking through depression and going through therapy that you didn't want to be in. There's a lot of things you did that you didn't want to do. And then
That's
there's the next piece, and then you embrace that next piece.
yeah, yeah.
Yeah.
I think I definitely had a lot of luck in my life, and I think I was, my one of my big one of my big blessings in life has been mentorship, and to me that has been invaluable in my life
Mm.
as somebody who never saw myself as anything but a broken person who wanted to just hide away all my life to believing that I could be something other than that or somebody other than that, was so important to me. I hung onto it with my dear life during moments that were bad. And there were many moments that were bad in my life. And that
Hmm.
were not maybe not bad. Bad is the wrong term, maybe
Okay.
challenging and tough.
Mm. Yeah.
Yeah.
Yeah. Yes. Okay. I have questions for you.
Okay. I'll try to answer them.
Let's do some questions. I mean, I actually feel like asking a lot of questions from what you just shared. Um, I really feel like your story is so important because of how much you've been through, because so many other people are going through really hard things. And I'm so grateful that you would open up and share so honestly and so real about the depression you walk through also. Because not everybody will talk about how that sometimes the experience with stuttering and other things can lead people into very dark places and get trapped in a place of depression. And how do you get out of that? There's been presentations on higher suicide rates in people who stutter. So there is a real issue here and a real concern. But to see that you got help and you continued forward and it did change for you is also really hopeful and a model for people to follow. Like it is okay, to maybe it's not the exact protocol that you did, but that's the one that helped you navigate that time and you went for it. So I also love how you brought up, you wanted that 3-week intensive program. And it's so cool that you were given some advice like, look, this is actually not a quick fix. And you're like, yeah, but you know what? I need some kind of control. I need something. I see the long-term thing that we're trying to do. We're working on probably acceptance and other pieces of unraveling, you know, but you were like, I need something almost, maybe tell me if I'm wrong here, but to like hold you over while you were continuing to work on those other pieces. I don't
Mhm.
know.
True. Absolutely. Like I needed some hope to hold on to that. I needed something I could use. I needed some immediate result that I could then hold on to when things got tough. And that was the immediate result I was hoping for, was to have something in my toolbox that I could reach for. And maybe it was imperfect. And
Yeah.
maybe it wouldn't work all the time, but
Mm-hmm.
I had something
Mm-hmm.
that I could hold on to.
Yeah. I love that. Like held it kind of like held the space for you as you continued your journey to really get into some deep root stuff. Um, I don't know how much you've stayed in connection to the stuttering community or the stuttering therapy world, but it has changed a lot since back then. And a lot of even myself, right? So the field changes, therapist changes, people who stutter change. Everybody's like on this continuum of change. And um, anyway, maybe I don't want to open up a can of worms about those pieces because that's more of a therapy discussion of like I feel like your story, because I knew that part of it, has inspired me to hold space in my practice with people who might be coming and saying, I need a physical tool with some kind of control right now. That is just where I'm at. And I know you're talking about advertising and acceptance and open stuttering and all these things. I can't do that right now. I need something. And maybe it's a quick fix. And the therapist is like, no, we can't do that. It doesn't help them in the long run. But it held the space for you during that time. It wasn't your be all end all, but it did something. And so I'm trying to navigate that myself of who to hold space for with those strategies and control tools and follow them as they walk out their journey and plant seeds of there's more to this and maybe you're ready for it now. And now we can go deeper and we can get to true freedom and not band-aids, but sometimes you need a couple band-aids perhaps.
Yeah, and I think that's what makes you such a gifted therapist, is that you can do that for others. And you've given me plenty of tools when I did intensive speech therapy with you. So
There's a
no,
lot of
I
tools in that program,
agree.
yes.
Yes. But I think it's like that in lots of different places, probably not just therapy, but one size just may not fit all, and maybe best
Mm,
evidence there
mm,
for practice may not be what that person needs at the time. Maybe they just need something in between.
mhm. Yeah. Yeah, people need different things at different times and different places. And your story also shows that as well. Okay, let's dive into a couple more questions.
Okay.
I'm interested, well, some of these you've kind of answered within your story too. Oh, let's go into this one because we were talking a little bit about advertising, otherwise known as self-disclosure. And this is just sharing that you
Sorry,
stutter.
like, I'm sorry if I get the terms wrong. Yeah.
No, they're just
Okay.
changing them. They're
Okay.
changing them over time. Things
Okay.
are things keep changing. So we're
Okay.
just throwing
Okay.
out a few terms, but it will define it, which is telling someone in some way that you stutter. And everybody does this differently. Um, and I know you did learn how to do that initially in that intensive program. And so my question is, did your use of self-disclosure about stuttering change over time?
Mm. Well, I think I used to do a lot of it when my stuttering was very severe, and when I find myself in situations where I give a speech, or I stutter more than other times, I sometimes use that as a tool just to help myself relax. Like, I can just disclose. I don't need to, I could lean on that. I disclose very rarely these days because I feel pretty comfortable with myself overall, and I don't feel like a great need to advertise, but I certainly used to use it a lot as a tool I used to use it a lot as a tool when I was going through my education pathway because we had to give lectures and, all these
Mm,
talks. And I just, it's just like, oh my goodness, I'm going to get up there and just, it's going to take an hour for me to give a 30-minute talk. And someone should know about that. So, and it just
mm,
eased
hmm,
my own internal anxiety about how I
mhm,
think how I perceived I appeared to others, having said that up front.
mm.
But to be honest with you, I think
Yeah.
people know when, I mean, the disclosure is more for me because an observer can tell when somebody is stuttering. So did they probably need my disclosure? I'm not sure, but it made me feel better at the time, so I used it.
Mm-hmm.
I don't use it anymore because I just
Mm-hmm.
don't need to lean on it anymore as much.
Mm. Love that explanation because it is a process. And some of these tools, just like you said, you use them to get to this next place. And now I don't need to. Or maybe a situation pops up here and I do there, but it's not like part of my repertoire that I use all the time.
Yeah.
Yeah. Let me see. Hmm. How do you define success around stuttering and communication? Has this changed over the years?
That's a great question. I define success around stuttering as, I would say, acceptance of what it is for you as a person, of what it means to each and every one of us, just accepting it as a part of ourselves, and in accepting it and not giving it so much power all the time brings a different experience and allows for a different, for you as a person who stutters to have a different experience. My success, I defined not thinking about it every moment of every day. I used to think about stuttering every waking moment of every day, from when I woke up in the morning to when I went to bed. What sounds were coming up? What words could I substitute? I mean, we're all like walking thesauruses, like what word can I say? What word can't I say? It was just, it's a constant dialogue and it's exhausting. It's exhausting because you don't even realize it's exhausting because you're so used to it. But when it stops, and the first time you realize it, that it doesn't consume every moment of your everyday for whatever reason, whether it's acceptance or whether it's self-work on other things and healing from other trauma that was related to stuttering. I think that's a real success for me. And for every one of us, it looks different, which is what makes it so hard because there isn't one way to approach this process. It isn't like one path. Okay, I get on a path from A, I'm gonna get off at B, and then I'm gonna be all right. It's more like choose your own adventure and check in with yourself. You know, I I think for a lot of for some, and I don't have, I'm sad to tell you that I don't have many friends who stutter because every single person I met who stutters is absolutely incredible. I have yet to meet somebody who stutters who I've disliked. Like, have
Mm,
yet show me that individual.
mm-hmm.
Everybody I've met are smart, kind, compassionate, just introspective and curious, and just have so much to give and contribute. And I I think I've met people who stutter, my friends, used to in the past, I've had like one friend here and there, but really not a big community.
Mhm.
And I don't remember what I was going to say anymore, but I lost
Okay.
my train of thought. But I think for everybody that acceptance has been different. I mean, I've seen people, and especially kids today, are amazing. They grow up with so much acceptance around their speech. And I am so blown away by their bravery and by their courage to just get up there and say what they need to say and just
Mm.
accept who they are and that this is the way they speak. And I think the world is changing in some ways towards that, which makes me so happy. And that didn't exist when I was that age. And
Mm.
so I think for a lot of us, that success is acceptance. For some of us, the success is fluency. For others of us, success is what I defined. And you can make different permutations of that. And
Mm.
yeah,
Mm.
I know. I'm sorry, I'm rambling a little bit. I
Mm.
apologize.
No, these are good rambles. I'll take them. um, let's talk about a little bit of the stuttering community in the sense that we were talking about this before anyway, but just and you had mentioned that you did go to an NSA conference, National Stuttering um, Association. I wanted to say Awareness Association, and their annual conferences. So I've noticed some people are very nervous and don't want to go into the stuttering community or to a conference or to be around others who stutter. They're not ready for it yet. It's overwhelming. Sometimes they need guidance and time, and eventually they go, and it's like, oh my gosh, it took so long to get here. These are my people. Other people are like, where? Sign me up right now. I'm ready. You
Yeah.
know, I actually have some clients who are not traumatized by stuttering, and for whatever reason, it's small enough in their life or less of an impact that come in and out of therapy pretty briefly. And they wouldn't even think of connecting to the stuttering community. They come in, they get a few things. Stuttering's kind of annoying to them, but it didn't traumatize or alter their life in a really big way. And so that's like another kind of group on this kind of wide spectrum too. In I guess in my professional opinion of what I've seen come across in my practice. Um, and so some people go into the stuttering community or into the where the conferences are and the gatherings and being a part of people. The wonderful thing is there's so many opportunities now. There's online opportunities, there's in person for kids, for adults, for everyone. There's various organizations and even practices that do it. Like it's grown, which is wonderful. And then there's a group that can even get into that community, but stay there for a very long time and not kind of integrate back into life and real like living outside of that community. And I find it interesting to look at all of that and to not judge it and say it's supporting people in different ways or sometimes even not needed all along the way. So what was your journey with that? So you connected to NSA, went to a conference there, connected to people, and then was it any more part as you journeyed along? I mean, you were in the group, which was stuttering community when you were in the intensive. What happened? Yeah. What happened after that? Did you go to any other conferences?
Mm-hmm. I think NSA and other organizations that support people who stutter and promote education and research are absolutely amazing and necessary. And I'm grateful that they exist. I think they're so
Yeah.
instrumental in connecting people and creating that space and community, and also raising awareness and promoting education and research that's so needed about stuttering. I my personal journey with it was that I actually when I went to the first NSA conference, I made a friend there, and this is a friend I've had for many years. And he was my community. I didn't, after I met him, I didn't feel like I needed another community.
Mm-hmm.
Um, he had everything I needed in my community. He was somebody who shared stuttering with me, but somebody who's also was on the other side of my angst, who's had as much trauma as I did, maybe even more, and was on the other side. And sharing that with him and seeing his progress was all that I personally really needed. And so it
Mm-hmm.
wasn't like I was completely out of touch with any community, but I felt like having him in my life was everything. And I didn't feel a great need to go to more meetings or
Mm-hmm.
share experiences with others. I was also, I am somebody who grew up feeling very isolated from with my speech. I had very few friends as a child. I felt like I was always on the outside looking in. Um, and I never really had, like a tremendous group of friends that I needed to connect with. I was always more like just more closely knit group. So that's, I think it goes with my personality and my needs also, probably, as opposed to something that's universally shared by people. But my friend passed away in 2018, and it was a hard loss, and I tried to reconnect with the stuttering community again a couple of years ago. But I found that I was in a different place when I tried. And I felt like, as much as I appreciated them and enjoyed being a part of that community, I felt like I wasn't, it wasn't receiving what I needed. Also, I was very happy to be a part of that community, but I felt like I needed something different now. I wasn't the same person I was the first time I was there. It's also been like over 20 years probably at that point. So, I stopped going to more meetings, and I'm just kind of okay with that, I
Mm-hmm.
agree with what you said though. I think it's just I have I think I have a belief, and this is a pretty strong belief based on my personal experiences. I feel like if you're somebody who has a lot of trauma from stuttering, or somebody who's just gone through mental anguish of it all, I think you need somebody in your life who understands what that's like. It doesn't have to be a big community, it doesn't have to be a big meeting, but it's a person, it's a human, whether it's a therapist who understands what that's like you, Shamini, or a friend who stutters. I think that connection is invaluable, and that space that you share is invaluable because nobody understands what that's like. But if your stuttering is mild and you probably find it more as an annoyance, which is so great, it's amazing, then that's wonderful. And you may not have the same need for a community, you know?
Mm-hmm. Yeah. I love what you brought up with personality, because that's a component too that I think isn't brought up that often also. Like maybe, right? And even introverts and extroverts, although anybody can go into community, but it's very personal. And I love your perspective. Like, here's another way. There was one individual that was really instrumental, kind of as a mentor during that time, who was on the other side, who inspired and encouraged and connected with you. Great. That was enough for you, and that's okay. So again, this flexibility of what works for you, and not everyone has to go into therapy, not everyone has to go into a big community, not everyone, right? We want that, like you said, get on this path and do this and you'll end up there. And it's like, well, no, there's a lot of options, and let's see what resonates for you. What is your story? Your story and your path will be different, even if the stuttering is an overlap and a lived experience that you really connect with other people on. I'm going to ask you about your younger self and advice that you would give to your younger self, or perhaps something you wished you had known when you were a child. Just looking back now over this, all that you've walked through to the place you've come to now.
Hmm. Well, I think I would tell myself that I'm gonna be okay. And I probably wouldn't believe it as my younger self because I felt really annoyed when everybody would say, "You're gonna be fine. Don't worry
Mm,
about it. It's nothing. You'll get better. You'll be." I mean, people around me defined my stuttering success as fluency, including my parents, people that, I looked up to. And it was just kind of the way they were brought up because and then the knowledge that was available at that time, so my success, my younger self believed that if I could just be fluent, that I could change the world, that I could just do anything I wanted to. I wanted that more than anything in my life at the time. But it was how
yeah.
others defined that around me, I think, too, because that's what they wanted for me also. And I just
Mm-hmm.
didn't know better at the time. And I would tell myself that I'm gonna be able to say what I want to say, probably,
Mm.
and people will listen.
Mm. Yeah.
Yeah,
Yeah.
I think that's probably it. I'm not sure I would have believed it, but again,
Mm-hmm.
it's hard to believe these big, lofty statements.
Mm-hmm. Mm-hmm.
But maybe if my older self would write that to my younger self, maybe I would
Maybe
have.
it would hold a little more water than somebody outside of you. Yeah.
I mean, if I could do it all over again, right, which nobody can do,
Mm.
I'm glad I don't have to do it all over again. I've lived a wonderful life, and I am who I am because of my speech and because of what I went through. And I think it's made me a stronger, more resilient, more compassionate, more empathic human being, and
Mm.
a very more determined person too, probably as a result of that. If I had to do it over again, I wish that I knew that I needed therapy sooner. I wish that I
Mm.
realized that sooner. I think I would have spent less years anguished had I gotten therapy as a young human than
Mm.
when I've gotten therapy in my mid-20s.
Mm-hmm.
Because by then the collective trauma has already accumulated, and I didn't see myself as anything but broken, and it was very hard to see myself as anything but that when I was alone with myself in that small private space inside of a sort of big expansive private space, right? Like when it's just you
Mm-hmm.
and you, I
Mm-hmm.
felt broken. And that was just the bottom line, just because of my experience with it as a child and as an adult. But had I realized sooner, or had people around me realized sooner how many other things I was putting into my stuttering, including things that I needed to work on for my mental health separately and concurrently,
Mm.
I think I would have been a much more well-adjusted human and probably have had less trauma overall. That's what I wish for. If I could do it
Mm.
over again, I would do it sooner.
Mm.
Um,
Mm-hmm. Yeah. Yeah. And it sounds like you would do certain types of interventions and help sooner, because it does sound like when you were younger, you had help that was very odd.
yes.
That's maybe the
Me too.
kindest word to put on it. I literally haven't met anyone who has, and I didn't know this about you, that you had to have marbles in your mouth. Like I've
Yeah,
always heard of that, and we know in the King's Speech movie even they mention it, but I can't believe you actually. I mean, in that and of itself can be a trauma to somebody, depending on how you interpret it and take it and what's happening in that moment. But and then what did you say? Spitting, like some kind of
somebody was
weird.
like sitting around me. I don't know. Maybe she was like warding off evil stuttering spirits. I don't
Yes,
know. That's what it sounded like.
that's scary.
She was dressed in all black. I distinctly remember just being very afraid as a child, like
Well, yes.
and what's
I mean,
happening, you
that's
know? But
horrifying.
I mean,
Yeah,
clearly it was my mom's every attempt to
yeah,
make me better,
yeah,
which comes from a very good place. And
yeah.
it was just maybe what she's had available to her at the time.
Absolutely, right? So many times parents are, their intention is so good coming from the right place, but the lack of education and understanding and different cultures too. I had a client from Haiti who had to drink out of like the horn of an animal and he wasn't allowed to use the normal cup. I mean, and going to witch doctors. There's some crazy stuff that,
Yeah, yeah,
and what impact that, like what message that sends to this impressionable little soul. But look how resilient, even stuff like that. And like here you are with your own family and your career and your well being and all of the speaking that you do. I don't know if you meant you got too into that and your bio doesn't really explain, but from what I understand, like you're giving, like you're speaking as a speaker, right? You're like an invited speaker as a doctor to certain things
yeah.
related to toxicology. Like, yeah,
Lectures, grand
lectures.
rounds, speak nationally sometimes.
Mhm.
So yeah, I do all those things.
Yeah.
Sometimes I still can. I have moments when sometimes I still can't believe it's me out there. Like I think it's
Oh,
not really me, but those moments are fleeting.
yeah.
And just because I've had so much gifted opportunity to grow into my own and be
Mm,
comfortable with who I am and heal from a lot of
mm,
the things in my life, and then stuttering just kind of took a back seat, and when it didn't
mm,
come as focal, the sole point of my entire existence, I actually became oddly more fluent. It was very strange. I am not using any tools.
mm-hmm,
I grew up a very severe stutterer. And like I said, until my mid-20s, I could not say a sentence fluently. I could not. Maybe once in a great while. But it was odd, and this is my journey again. And it
mm-hmm,
doesn't always, it's not everybody else's journey, but my stuttering decided to take a bow when I healed, and it comes out. Don't get me wrong. It's because Shamini, I know you, and yeah, obviously I'm comfortable with you, and we're on Zoom. I'm not in
yeah.
front of 200 people trying to deliver a talk. I mean, or even when I give
Sure.
lectures to my fellows, I still, I still have facial movements and they block
Yeah.
sometimes, and that's okay. But
Mm,
I have a moment. I remember where I was. I don't remember the date, and you're going to appreciate this. I was on 86th and 3rd, no, 80th and Lex in New York by the subway.
I can picture it. Yep.
Yeah. And I just finished talking to Dr. Riley because after I moved, she remained my therapist through residency in Baltimore. And this is before telehealth. We used to talk on the phone.
Mm,
And New York until she retired in 2018. Um, And I remember I just finished talking to her about something. I don't think we had a session. And then I remember I had a thought in my mind. Wait, when was the last time I thought about my speech? And then I realized, oh my
Mm.
God, I'm not thinking about my speech every minute of every day. And it was such a profound thought for me. I I don't get, I was probably in my like, I don't know, my mid 30s or maybe early 30s. I'm now almost 45. So I remember that moment just because that mental anguish and the constant dialogue inside my head wasn't there, but I didn't even notice when it went away. I just one moment realized that it was not there all the time. So, yeah.
That is powerful. I'm so glad that we've just continued this discussion because these are okay, this is called words of wisdom. I think you've like spoken so much wisdom here in that in this story and like the fade out of stuttering sometimes in the more current more often used therapy that's growing that has a lot to do with acceptance and reducing avoidances and speaking and even not ever teaching a physical tool. What happens is this byproduct of fluency that you're never going for. And you know, you just explained like this moment where you became aware that it's not in your mind. I've had clients say, I like they're stuttering, but it's not registering as stuttering anymore because they're just talking. But if you were to record and listen back, they're stuttering in there, but it's not registering. It's not traumatizing as stuttering. The awareness is gone because it's been neutralized, accepted, okayed, whatever. And that's such a cool story of your life in that moment. That was so profound, right? It sounds like freedom. It sounds like,
Yeah, I mean, if you were to ask me when I was a young adult, I think I would have just rolled my eyes when you said I was gonna get there because there's no way, like when I met you initially, there's nothing you could have said to me that would make me believe that. Nothing. It was just doing the work and putting one foot in front of the other and just not giving up that you just need that you're going to heal. You're just trying to heal whatever it is, whether it's speech, something else that's driving the speech, but you're on the journey. And it's this, for some of us, it's a short journey. Some of it's a long one, but you show up even though it's hard and you put one foot in front of the other because you have no other choice. You're too resilient and you're too smart and your voice needs to be heard and there's no other option but to put one foot in front of the other. You can stop for a minute, but you gotta keep going, and stuff. But one fine day, I don't know how it happened, but it did. It happened for me and it can happen. I know if it happened for me and I thought I was a lost cause, it could definitely happen for other people if that's the goal overall. But the key is to keep going.
mm-hmm. I'm going to end it on your words and just
Okay.
thank you for sharing your words of wisdom and your truth and your story. And I just love you and appreciate you so much.
I love you too and appreciate you. Thank you for helping me back then and for helping all these humans who stutter. They're so lucky to have you as a therapist.